Welcome back. As we age, the key is to not only maintain good health, but also prevent problems along the way. And for seniors, a lot of the help needed is already covered by Medicare plans. The question is, do you know what's included in your original Medicare or Medicare Advantage plans? Here to discuss the importance of being proactive with your health care and what services Medicare beneficiaries can access at no additional cost is the Regional Vice President of Health Services in the Gulf South region for Humana Medicare, Dr. Rebecca Colon. Hi, Dr. Colon. Hi.
Hi, thank you so much for having me on today.
No problem. So let's talk about why proactive care is so important for long-term health.
Well, taking charge of your health is really the best way to be proactive, right? So what I would say is being proactive is not waiting until you're sick or in pain to visit your primary care doctor, but making an appointment and going in, especially at the beginning of the year, to get your annual wellness visit done. It will give your doctor an opportunity to address health concerns you have, but also diagnose and screen you for chronic conditions such as diabetes and glaucoma, as well as other cancer screenings. So really, proactivity is just about making that step to get that wellness visit in. And at the beginning of the year is a perfect time to do it.
Yeah, and so I want you to tell us about the passing of the Inflation Reduction Act and how that might affect our current plans.
You know, the Inflation Reduction Act really provides us with some enhanced benefits in the pharmacy space. So the Inflation Reduction Act will provide additional coverage of the vaccines, such as the shingles vaccine, as well as low-cost co-pays for insulin for our diabetic patients.
Yeah, and you know, recently I've been hearing that there's a rise in value-based care, but what does that really mean?
Oh, value-based care is wonderful. What it does is it is a patient-centered approach, and it focuses on the quality of the care that the patient is receiving. So for physicians that are in our Medicare Advantage value-based care programs, it really gives more freedom to the doctor to spend more time with their patients and make sure that they're addressing all of the preventative care needs that every patient has.
Yeah, and you know, Dr. Colon, with inflation continuing to make groceries and everything else much more expensive, and the fact that many seniors live on fixed incomes already, what would you tell Medicare beneficiaries about the financial impact of understanding their benefits?
It's really important to know what benefits are available to you and make sure that you're maximizing those. If you're in an original Medicare plan or you want to learn more, you can check out medicare.gov. Or if you're in a Medicare Advantage plan, make sure that you check out your plan documents to ensure that you're capitalizing on all of your benefits. Some of the benefits or some of the plans have $0 premium plans. They have flexible spending accounts that can help with cover groceries and rent and even utilities. So there are some benefits out there to really reduce the pressure that we're feeling at this time.
I love that. Well, you know, because I was just going to, I'm glad that you mentioned that, because I was going to say, you know, at the end of last year, we heard about the available Medicare beneficiary, the things that are available to beneficiaries, like the transportation to medical appointments and financial assistance and groceries, all of that. And it could be a bit daunting, you know? So I was going to ask, how can we find out what's available to us? Because it's a lot sometimes when you're taking all of that on, especially if you're taking it on by yourself, right?
It is. And you know that it can be daunting, and I would absolutely recommend checking out medicare.gov. But if you're in a Medicare Advantage plan, you can reach out to your plan or check your plan documents. A lot of the plans have dental and vision and hearing, and like you mentioned, transportation benefits. Some have telehealth visits, others have fitness benefits, so you can actually, you know, get your gym membership covered. We really want to focus on health and well-being so that, you know, our seniors are really living their best lives.
I love that, because I know for a fact there are some people out there who do not understand and know all of the benefits that are, you know, available for them. So thank you so much for stopping by and really making that clear for us.
Thank you so much for having me today.